One of the most confusing aspects in baby care is complementary feeding. What to start, when to start. So today we'll be dealing with complementary feeding of infants, which will be based on 2001 guidelines by WHO and 2016 guidelines by IYCF, which is a Government of India organization. First guideline, the baby should be exclusively breastfed until 6 months of age. All the nutrients that a baby requires is met by breastfeeding until 6 months of age. But do not stop the breastfeeding at 6 months, continue that until 2 years of age. That is a second guideline. The third guideline is to practice good hygiene and proper food handling. Clean food, clean hands, clean utensils. Avoid bottle feeding. Guideline number 4, responsive feeding, applying the principles of psychosocial care. Infants should be fed directly, and slightly older children should be assisted with their food, and they should be trying to eat by their own. Feed them slowly and patiently. Encourage them to eat. They should not feel like going to a battlefield when they are taken to the dining table. Children may refuse certain foods. Experiment with different combinations, different taste, textures and methods of encouragement. But never try to force feed. Minimize the distractions during the meals, especially avoid screen time during meals. Talk to them, play with them, sing to them, talk to them with eye-to-eye contact during food while you are feeding the child. Guideline number 5, start with small quantities of food and gradually increase it as and when the child gets older. This quantity of food is decided by the tummy size of the baby, the appetite of the baby, and not by the size of your bowl. Guideline number 6, gradually increase the food consistency and variety. At 7th month, the baby should be starting semi-solid foods, pureed vegetables, mashed vegetables. By 8th month, they should be eating finger foods. By 10th month, they should learn to chew lumpy foods. By 12th month, they should be eating from the family pot. After completion of 12 months, the baby should be eating only what you eat. Avoid foods that may cause choking. Something like nuts and all may cause choking, and the baby can have problems. So avoid that until the baby is slightly older. Guideline number 7, increase the number of times the child is fed. When you start once a day, and with 2-3 weeks gap, gradually increase it. By 7th to 8th month, they should be having 2 to 3 meals per day. By 9th to 10th month, they should be having 3 to 4 meals per day. And by 1 year, they should be having 3 meals plus 2 snacks. And in snacks, try to incorporate fruits or vegetables and other healthy options. Avoid chips, bread, biscuit and all these items are available in the bakery, which gives only empty calories and no other nutrients. Guideline number 8, feed variety of nutrient-rich foods so that all the requirements are met. Complement cereals with pulses. Introduce fruits and vegetables. Once the baby learns to chew, provide non-veg food as well. Introduce milk after 1 year of age. If you keep on giving one particular kind of food, it won't give all the nutrients that is required. So mixing food is very important. Guideline number 9. As per the national schedule or recommendation, use fortified supplements, vitamin supplements. The common ones are vitamin D for all babies, iron and calcium for preterm babies, and vitamin A for all babies incorporated in the vaccination schedule. Guideline number 10. Never force feed during illness. When a baby is ill, they won't have taste, they won't have smell, they won't feel like eating. So if you try to force feed, they puke whatever little thing they would have taken if otherwise. Increase the fluid intake during illness. It's the hydration that has to be maintained during illness. And encourage breastfeeding because it is easy to digest. Give them whatever they need, whatever they ask for. Provide them their favorite foods. And after the illness, during the recovery period, they usually have voracious appetite. They eat a little bit more and compensate for the previous loss. And then they return back to the baseline. So start feeding your infant based on these 10 principles. Let them enjoy their food and you start enjoying your parenthood.